The number one shared sentiment about Medicare is Medicare is a very confusing program. The number one questions I receive is, why is Medicare so confusing, particularly in terms of trying to understand the costs inside of Medicare. So today's question is, what is my Medicare going to cost me? Now, we'll get to that question in just a moment, but let me introduce myself. I'm Ron Plusinski. I own the Integrity Agency, a full-service independent broker, and we help people like you find the health insurance you need, Medicare that you need, and we help answer all your questions through this YouTube channel. We help to answer your complicated questions with simple answers. Now, let's get back to today's question. Ron, what does my Medicare cost? Here you go. First, remember from the other videos on this channel, which I hope you watched, there are four main parts of Medicare. Medicare Part A, Medicare Part B, Medicare Part C, and Medicare Part D, as in drug. Now, let's take those one at a time. Medicare Part A is hospitalization and only hospitalization. That's all that it cares about, is if you're laid up in a hospital. Now, most people, if they've worked 10 years or longer, will receive Medicare Part A for free. Medicare Part A is also called premium-free Medicare. Now, Medicare Part B, unfortunately, is never free to anybody. Our Uncle Sam likes his money. Medicare Part B premium right now is about $202.93 per month. Now, Medicare Part A and Part B together make what we call Original Medicare. It's the first two parts you're going to enroll in, also called Original Medicare, because those are the two parts you receive from government. Now, if you're high income, unfortunately, your Medicare can get quite costly. For high income people, Medicare Part A does bear a cost, and Medicare Part B bears an even bigger cost than that original $202.93. To put most of you at ease, most Americans do pay the basic $202.93 monthly Part B premium. Let's go back to Medicare Part A for just a moment. And let's look at the costs inside of Medicare Part A. On the outside, it's premium free to you, but if you ever get hospitalized, a Part A Medicare deductible of $1,767, that is subject to increase from one year to the next. But again, right now, $1,767 or so per month. $1,763 is the deductible in Medicare Part A. But it's very important to understand, we think deductible is an annual cost that you must pay. Inside of Medicare Part A, your medical deductible is per benefit period. And they define that as 61 days or greater. That creates a second benefit period, so that if you go back in the hospital in that same calendar year, you've got a second deductible to pay. So Part A is premium free. Inside of it, when you're hospitalized, you have a per benefit period deductible you will pay. Now, after that deductible, you're still subject to certain cost shares. It is very important to keep in mind, Medicare Part A, and for that matter, Medicare Part B as well, do not have out-of-pocket maximum. An out-of-pocket maximum in any type of health insurance, whether it's healthcare marketplace or in this case, Medicare, is your friend. It keeps you financially safe when something critical happens. 20% of your hospital stay and 20% of all the medical services you receive under Medicare Part B. Medicare Part B is everything else. Remember, Medicare Part A, just being in a hospital bed. Medicare Part B, therefore, is everything else. It's seeing your primary care doctor. It's being referred out to a specialist. It's going to an outpatient surgical center. You name the medical service, it is likely going to be your Medicare Part B. Now, let's take a look at the overall cost of Medicare Part B. Again, the monthly premium right now is $202.93 per month per individual. Please make sure you watch the short video that talks about the #1 mistake seniors make with their Medicare.